you is about splenectomy in a child. I think, Dr. Peter, you can, if you see the screen, you can, I read it and you can start. You see the screen now.
Yes.
Okay, so this is about Smith. Smith is a 9 years old boy injured in the park mean garden, admitted for splenectomy, and the consent was signed by his father. His mother is angry at the time, the child in the theater, and both parent and are separated as the child father is an alcoholic. Alcoholic means he drink a lot of alcohol. Patient hemoglobin dropped from 9 to 8.1. His abdomen was rigid. He had a fracture in the lower left side of the rib. The situation, uh, the situation was explained by father, explained to his father, who signed the consent form. The consent was taken by another doctor, not you. You meet the patient mother in emergency department. So to summarize, female mother angry, her child uh, under surgery now for removal of spleen or splenectomy. She is separated from her father because she drank a lot of alcohol, and consent is not taken by you from the father, is taken by another doctor. Okay? All right.
Okay.
All right. So just read it for 1 second, and again, we give you.
I'm ready.
Yes. Okay. Just a minute. Okay. So first, I tell you, in these stations, we have examiner, and we have something called lay examiner. The lay examiner is some from public, and the actor usually is professional actor. Usually they are standing, and the patient mother is standing. Okay, so you need to discuss that. Okay, so you can
Mhm.
start.
Okay.
Both are standing, so the mother is standing. If you see me now,
Mhm.
so I suppose I am standing. Okay,
Okay.
so you enter the station
Good.
and give me your ID number or student number. Okay, you can start, Dr. Peter.
Okay. Good morning. My name is Dr. Peter, one of surgical team for today. I would like first to confirm that you Smith's mother. Are you Smith's mother?
Yes, I am Jane. I am a mother of Smith. Where is the Smith? Where is the Smith? Usually shouting to you and ask,
Yeah.
where is the Smith? And she's standing. She's still standing.
I'm here to help you to know everything about your
Doctor, where is
son,
the
but please
Smith?
first,
Where is the Smith?
could you please? Okay, I will answer all your questions, but please first, I would like you to have a seat. Could you have a
No,
seat, please?
the patient not sit down. She is still standing. You need to answer the patient first.
Oh,
And okay, so where is my son? The patient shouting to you,
um,
or the actor shouting to you, and where is my son?
your son. First, I would like to ask you, what do you know so far about your son?
I don't know. They call me and say he is in the hospital and he's dropped in the park.
Okay,
So the
let me
patient is still
explain to you
standing,
what
doctor.
happens.
The patient is still standing, and you are still standing.
Yes.
So where is my baby? Take
Do
me
you
to
like
my baby.
do,
Take me to my son.
do you like okay? Do you like to complete our conversation while we are standing?
I need to go to see my son.
Okay, let me first explain to you what happened to
No,
your
no, no.
son.
I don't speak
Your
to you. I
son's
need to see my son. You need to answer here
your son
accurately.
is
Yeah.
your son in theater right now doing an operation
Okay. So,
because
Dr.
your
Peter,
son.
how much you belong? Tell me that. I think 1 minute, 2 minutes. So it is wrong. So it is important from the beginning to tell her she's a patient is standing, the actor is standing, or the mother is standing. She is shouting to you. Some patient is very shouting to you. So okay, calm. Your son in the theater. We don't allow to go to the theater now. So he's now the surgery was done. Okay. So at this
Okay,
time, if you say that, the patient sit down because in the comment, some of the students say to me, "This is the actor is still standing. She is still standing till you tell her your son is in theater. We don't allow, even me, not allowed to go to the theater. So sit down. I explain to you the situation. After that, after he finish the surgery, so I take you to see him after he get out from the recovery room." So it is important to explain to her, unable to see her son now because he is in theater. Don't say to her, sit down and I tell you later. So it is clear?
Okay.
Okay, so now we can start. Can we start from beginning? Okay, so we can start
Okay.
now
It's
from
okay.
beginning.
Yes.
Okay, so
Okay.
hello, doctor.
Good morning.
Good
Good
morning.
morning. My name is
Where is
Dr.
my son?
Peter.
Where
One
is
of
my
the
son? Yes,
yours,
I am Smith's mother. I am Jenny. I am Smith's mother. Where is my son? Can I see my son now?
Jenny, your son in theater right now doing an operation
So
and
can I go to
surgery,
theater to see
and
him? Can I go to theater to see him?
I'm I'm so sorry to tell you that, but it's not allowed to go to the theater right now,
All
and
right.
I will
Okay.
try to I will try to tell you everything about your son, but please, could you please first have a seat?
Okay. So at this time, the actor is have sit down. All right. She asks you some question, or you tell her. So first, where is my son in operative theater? Okay. All right. So the patient sit down. What is the operation? What happened, doctor?
First, I would like to ask you, what do you know so far about your son,
I don't know
Smith?
anything. I just have a telephone from the hospital. They say my son in the hospital, and I came. I found him in the theater. Even no one tell me, no consent sign for me. So tell me what happened.
Okay, let me explain to you what happens. Your son Smith came to us um, with his father in a serious condition. He has, and after doing some investigation, we found that he has a fractured rib in his left side, and also this fracture causing splenic haematoma. Do you know what a spleen is?
No, what is spleen?
A spleen is an organ found in the left side and upper tummy, and this spleen has a function of filtering the blood and
Okay, so
also
it is
a
organ
function of.
in the left side of the upper abdomen. Okay, so in this, if you have a paper, just you can make a diagram for that. Just show me the site, so you can show here it is in the left side. Okay, so what is the function of spleen?
And its function is filter the blood, and also its function to protect the body against some infection.
Okay,
So
so
your son came with
who
injury.
signs the consent, doctor? Who signs the consent?
His father signed a consent for the
So why
operation.
you don't wait me to sign the consent? Why you don't wait me?
I'm sorry for that, but your son was in critical and also emergency situation, and also his hemoglobin dropped about 1 gram. So we took him to the operation as soon as possible to save his life.
So who doing the operation?
My consultant will do the operation,
Is
and
it an
our medical
expert?
staff.
Is an expert in this operation or not?
Our medical team, our consultant and our medical team is highly experienced and also highly skilled surgeons, and they are well trained to do this type of operation,
Okay.
and they have experience to deal
So
with this
again, what is the
situation.
name of operation? What's the operation?
Operation, we have to remove this spleen if the
So
injury is
so how to know this
bit.
spleen is injured?
We did some investigation and scan, and we
No,
found
no,
that he
just
has
one by
injury in
one.
his
Doctor,
spleen.
doctor, this is my son is just less than 1 hour in the hospital. So you made, what is the scan you did? What is the investigation you did?
We did some blood investigation, and the
What
blood
is blood
investigation showed
investigation?
his hemoglobin
Yes, okay.
hemoglobin
Hemoglobin drop.
hemoglobin level.
Okay.
Yes, and the hemoglobin dropped about 1 gram, and also we did a scan like in ultrasound. We call it ultrasound, but it's like a jelly scan. We did it for pregnant. Are you familiar with that?
No, I don't know what is jelly scan. I don't hear about jelly scan, but I know ultrasound.
Ultrasound. That's okay. I'm
Ultrasound
sorry.
is common. I know ultrasound.
Okay.
When you examine
Ultrasound.
him, you can diagnose that he have ruptured spleen.
Basically, we are not 100% sure. We have to open, and
No,
after
no,
that, we can
doctor.
make
When you
sure.
examine him, suppose this patient have injury of his spleen or internal hemorrhage, whatever
Mhm.
the cause. What you expected
Yes.
clinically?
He was in
You
shock,
see, you
and
see the
also we
screen or
give him.
not? By the way,
Yes, I see
yes.
screen.
So the abdomen usually rigid. Of course, you speak about drop of hemoglobin and all these ultrasound use. Okay, so what happened if not remove the spleen?
If we don't remove the spleen, we have to make. We sometimes maybe doing some suture to repair the
No, no, no,
injury,
no, no,
and if the
doctor.
injury is
It
not.
is not my question. My question, if this is patient or my son have injury with the spleen, and I don't and you don't remove, you mean that I don't give you permission to remove the spleen. If not allow the patient to go to the theater, what happened to him? What happened if not to remove the spleen in the splenic injury?
If we didn't do that, it will affect maybe his life, and he
What you mean by affected
maybe
his
lost
life?
his life.
His life, so he may
He maybe
die.
lost his life.
Okay, all
Yes.
right. Okay, so can you remove just the damaged part and leave the rest of the spleen or not?
We will try to do our best. Our consultant, he has to see first what is the injury, because the scan suspect that there is injury in his spleen, but actually we have to open and see what is the level of this injury. If in
Okay,
grade 1
so
or grade 2, we can.
how to know this grading and which grading you need to remove the spleen? We have 5 grades. You mentioned that you
About
have 5 grades. So which grade you must remove the spleen?
the fifth one and the fourth one, we
Four
may
and the fifth.
remove this
Okay, are
spleen.
you sure?
Yes.
Okay, all right.
Uh,
Okay.
I'm not sure. I'm
No,
not
no,
sure
you are
from this,
sure.
but I
No,
have.
no, doctor, I don't ask you, are you sure about my baby? I just ask you, are you sure that in the grading 4 and 5, you must remove the spleen and it is
Yes.
correct? It is medical knowledge.
Yes.
Okay, I don't expert in
Yes.
medicine, but it is a medical knowledge. Okay, so what happened without spleen? You mentioned it is
Sorry.
responsible for fertile bacteria. What happened if you don't remove the spleen?
If we don't remove it or remove it.
No, if remove, what is the life without a spleen? After you remove the spleen, is my baby how
Yes.
to
After.
manage?
Yes.
Okay.
After we removing the spleen, we have to get some precaution. First, we have to take some vaccine, and also we
What
have
is the
to
vaccine is?
taking antibiotic. Vaccine is a substance we inject it to the
What is the name
body,
of
and
vaccine,
the body
doctor?
will.
What is the name of vaccine?
The vaccine, actually, I don't know exactly the name of this
It is
vaccine,
like
but I will.
I know that from the health office that we have like mono like one vaccine, double vaccine, triple vaccine is
It's
something
a three
public
vaccine.
noise.
It's a
Triple
three types
vaccine.
of vaccine against
Okay, so triple
encapsulated
vaccine.
bacteria.
You know the name of bacteria,
Triple
doctor.
vaccine.
I have some knowledge because I worked as a nurse in some time in my life. So what is triple vaccine? Like for example, against pneumococcus
Yes,
and what else?
yes. Pneumococcus is the first one, and the second one is Haemophilus influenza, and the third one is Neisseria meningitis. And this is
Okay,
the
so
three
this is
types of.
three bacteria, so it is trivalent vaccine. I agree. Okay, all right. So what else you give to him?
We have to give him antibiotic, and this
For how
antibiotic we
long
will
do you
give it
give him
him until
antibiotic?
he is 9 years old. We can give it to him until 16 years old,
Okay,
and
so doctor, it
also.
is logic to give
Mhm.
the patient antibiotics for 5 years, 6 years, 8 years. I think it's not logic.
According to NICE guidelines, this is our
What is
guidelines, but
nice, doctor?
we have. Sorry,
What does nice mean?
it's guidelines
Guidelines.
according to.
No, okay, I
Yes,
will check for that. So suppose we don't this long life vaccines, long life antibiotics, which I don't agree with it. So we will discuss with the doctor later. But is any other antibiotic prophylaxis you give to any patient?
we have to give him penicillin
No, no,
against
I
this
mean it
type
is
of
any
bacteria.
surgical. Forget the spleen. Is any surgery you give prophylaxis antibiotic for how long? Suppose this is
About
acute
what?
cholecystitis or any operations. For how long do you give antibiotic? If you give prophylaxis
We have to give
antibiotic,
it for three doses.
3 doses, are you sure?
Actually, I'm not sure.
Yeah, yes, you are sure, doctor. If you are not sure, don't discuss the condition with me. Okay, is any alternative? Is any life change? He can go to school, he become handicapped, something like that?
He will practice his normal life after we removing the suture, but first we have to take some precaution because if there is anything happen, it will may affect the wound. So I will give you some sick notes, and I will let your GP, knowing that he has to take some vacation from the school. After that, and after he will be in fully recovery, he can practice his normal life and doing every exercise as he want and play with other kids, but with some
Okay.
precautions.
Is his father, you know that we are divorced. Is father drinking at time of consent taken? I know that you don't take
I'm
the
so sorry to
consent.
hear
It is
that.
another doctor. Yes.
Yes, I'm so sorry for that, but actually I'm not the one who taking the consent from the father.
Okay.
But thank you for sharing this information with me
All
at
right.
this time. Is this the first time to have something like this,
No,
or
no. It is in
is it happened
the
before?
2 months ago. My son have also cut wound in his right knee. Okay.
Okay. At this
All right.
time, I have to share this information with the Child Protection Service. And what I want you to know that your son safety is first our first priority. So I
Okay.
want you to
So,
know that.
doctor, where I will stay now?
Mhm.
Where I will stay? Can I go to theater?
Y-
Can I go to recovery room? Where I will stay?
You will stay in the ward waiting your son, and I will ask the anesthetist if the after the operation, if you can see your son in the recovery room. If it's possible, I will come to you and give you any updates. Do you
Okay.
have
Thank
any
you,
other
doctor.
question you want to ask about?
No. So,
Okay, let's summarize what we discussed before.
okay, can.
Your son came to us in a serious condition, and he has an injury to his spleen, maybe splenic rupture. So we take him to theater as soon as possible, and also um, we will do an operation for him according to the injury, but most probably maybe splenectomy to remove this spleen. And also we will, after removing the spleen, there is some precaution we have to do it. We have to give him antibiotic until the age of 16, and also we have to give him some vaccines. And you will wait here. If there is any updates, I will give it to you.
Okay.
Okay, Mrs.
Thank you.
Joy?
All right. Thank
Okay,
you.
thank you so much.
So, Dr. Peter, thank you. But you have
Mhm,
first major mistake you have is this one. You see the screen now.
mhm.
Is his
Yes.
father drinking at time of consent? Although you don't take the consent, but of course not. Why not? Because whatever who takes the consent, we don't take a consent from from any patient must have a capacity to sign the consent. So suppose the consent is taken by another doctor, sure, this is patient is fully conscious to sign the consent. Okay, so your answer here
Mhm.
is wrong.
Okay.
Of course, we don't write in the script that, but we tell you that it's taken by another doctor. But this another doctor, he don't ask him to sign the consent except he confirms that it's fully conscious. Okay.
Mhm.
Second
Okay.
question or second mistake, if you go to why you don't wait me to sign the consent. What is supposed the answer? Why you don't wait me? Why you don't wait the mother to sign the consent?
Because
By
we
the
took the
way,
consent of the father.
okay, so you need his father, you need the father consent, by the way. Suppose the father is not here, you need his consent.
It's
In
an
emergency
emergency. We
situation,
can't take type 4.
okay. So you just tell her this is emergency. Even his father is not here, we don't give him consent. Okay, so we don't need a consent. This can be consented by the consultant because this is life saving. It is a rupture spleen, like aortic rupture or what's called impending rupture of aortic aneurysm. We don't wait the family. We don't wait the father if the patient is young. So we don't wait. So whatever, we just tell him, but actually we don't need anyone to sign the consent because it is emergency situation. Second or third, Dr. Peter, you treat me that like I am what's called ignorant, like and so like the mother is what's called have no idea, is not in public. So of course, people know vaccination, and this vaccine is terrible vaccine, and this is against the bacteria. It is the exam is a combination between medical knowledge and ethics. It's not ethics alone, not medicine alone. So at least to tell her we give her a vaccine. In some country we call it pneumo vaccine, but actually it is three vaccine. It is pneumococcal, meningococcal, and H influenza. Of course, ultrasound. If you ask anyone in the public, even in Egypt or any country, I will do ultrasound, so he know ultrasound. Okay, all right. So
is it layman language or normal?
doctor, we suppose who is in exam is a English speaker, not layman. We don't have people come from like from street to attend the exam. This is well educated, and usually the lay examiner is have degree like master degree in the art or language, English language. He is not a layman. Okay, so ultrasound is ultrasound. So thank you. I just Osama Al-Gindi, I think he have a comment. So Dr. Osama, what is your comment?
أسامة القاضي.
أسامة القاضي, you are welcome. ازيك يا دكتور أسامة؟ أخبار المغرب إيه؟
أهلين دكتور.
Yes,
الحمد لله.
what is your comment?
My comment, doctor, this patient is coming my exam.
Yes.
And the patient أول ما دخلت الغرفة كانت crying.
Yes, it is typical in script, yes. But you don't tell her, she not sit down, except you tell her your son in theater, not allowed to go to theater.
بالضبط، يعني أول ما دخلت هي كانت تزعق وكانت واقفة يعني، فقعدت نقول لها please you can sit.
No, he don't sit in the script. She don't sit except after you tell whatever we do, it is not allowed for me and you to go to the theater because he's in theater. Now we don't allow to go to the theater. So at this time, she lay down. If you don't tell her she is in theater, she's still standing because they have some impressions that maybe died and you don't need to tell her. Maybe what happened, she don't know. Just tell her she is straight now in theater. Operation now is done by my consultant. I just come to explain to you. So not allowed to see him. So at this time, she will sit down. If you don't.
فعلا هو ده اللي حصل بالضبط فعلا.
تمام. If you make like Dr. Peter also, he start about 1 minute, 2 minutes. Can you sit down? I explain to you what you know about him. So this is not good policy. Okay.
تدخل في الموضوع على طول يعني حاول انك انت تفهمها على طول بس هي على
الاقل not allowed, just he's in theater, not allowed to tell him.
Yes. And ask me, the patient asked me what you can do, what happened for my child after operation. He's playing and go to the school, and what you can give after operation. فأنا قلت لها يعني yes you can go to the school and play as any healthy child, no problem, but you need to give vaccine after operation.
Yes,
قالت لي after how many day can you give the vaccine?
No, we give the vaccine when it's available. No, we give the vaccine when it's available.
After 2 weeks, I think, what's the splenectomy?
No, anytime, if it's available. If in some elective operation, we can give it before operation, no problem. No time, once it is available, you can give a vaccine.
بعدين قالت لي what you can give قلت لها vaccine and antibiotic. قالت لي how long you can take the antibiotic. فكان
Yes.
البيشنت عمره ذاك الوقت يمكن 16 سنه 14 سنين، قلت له عندي ايج اوف 16.
No, I
قال
think,
لهم
Doctor, this is a matter of antibiotic controversy. I think nowadays, in the most of the country, they don't give
just
long
prophylactic in the
antibiotic.
operation.
It is just a prophylaxis on the operation. Although in all the book, in some book and some guideline also, they say for long time, but is not practice in your country, at least in your country, or the doctor from Egypt. I think in his country, we don't have that. Okay,
Yes.
thank you, Dr. Osama. Any other comment you need to
Oh.
add?
Yes, I
Okay,
need
Dr.
to add
Shireen, if she asks me.
Okay,
sorry.
just to finish Osama. After that, we speak to you. Osama, anything you need to add?
يس انا لما قلت لها انه كان حندي له انتي بايوتيك فور اباوت 5 فيز اور 4 في، هي قالت لي ده مش ممكن يسبب له مشكله. This maybe that's lead to the complication. فقلت لها انا could be. قالت لي what's the complication can be happen. فانا ما قدرتش ارد عليها يعني.
No, he
فعرفت
just
ان الاجابه فيها خطا يعني.
he just need to tell you that we don't nowadays we don't give. In my age, in my time, we give antibiotic maybe forever, but now is not wise. Okay, thank you,
Yeah.
Dr. Osama. I think we have Dr.
Thank you.
Ahmad Tariq and Muhammad. Ahmad Tariq, what you need to tell? What you need to ask?
معلش يا دكتور شيرين according to the percentage
Say again.
الإجابة مش كويس.
No, I hear you slightly, but what is your question?
بقول لحضرتك according للكويشن بتاع البرسنت والجرام فازو، ممكن حضرتك الإجابة بس لأن أنا ما سمعتهاش كويس.
Okay, هو دلوقتي you need his father signature or mother signature or do you don't need anyone? What is your answer?
He don't need anyone.
You don't need anyone, so just tell her we don't need signature from the family. This is emergency situation. And for the question, he's drinking. Of course, no, because my friend or my colleague don't take consent from one except after confirm the good capacity. Dr. Ash Shaban, what you need to ask?
لا I just want أنا عاوز أشارك.
You just what?
أنا عاوز أشارك يا دكتور مش عاوزة
Okay. Next case. Okay. Dr. Muhammad, what you need to ask? Our MHMD, I don't know the name. Anyone, any question? Yes.
تمام يا دكتور. بعد اذن حضرتك، هو السؤال بس عشان انا كنت داخل متاخر. هو جزء اللي هو بتاع هل الانتيبيوتكس may be used long life، وتاني سؤال لو هي سالت مثلا
one by one. Which country you are, Dr. Muhammad? You are from which country?
Egypt، مصر.
Which hospital?
طنطا University Hospital.
So what is your policy in your hospital?
لا, vaccination, just vaccination only.
Okay,
antibiotic.
So if you tell something is not done in your country or your hospital, so you become a liar. Okay, if you are working in some area in India, we can accept other answers. But what done in your hospital is correct. We don't have bad medicine in Tanta, by the way. It's still good medicine. What is the second question?
Okay, thank you. Second question, لو هي سألت is he يعني her child will be a normal child or not يعني.
Yes, he will be normal. He can go to swimming, he can play football, he can do anything.
Okay, thank you.
But just to avoid any respiratory tract infection or exposure to cold weather.
Thank you so much.
Okay, thank you, best wishes. Okay, so we have the second scenario, and second scenario is the common and have a lot of controversy, and this is scenario we show to Dr. Aya. So just a minute. Okay. Okay, I share the screen. Dr. Aya, you can read. So is what is written here. This is the second scenario. And you see the screen, it is Mr. Gray wife. So you met the patient wife, came today to meet the consultant, Mr. Man, to discuss her husband case diagnosed as malignant ascites. The patient just admitted 2 days ago. Only done is a basic blood investigation and aspirated cytology, what we called it FNEC. from the ascitic fluid. He is not a smoker and drink alcohol occasionally. One of the staff told her, or told the patient, him yesterday, that he have advanced cancer and it is incurable and he's in the late stage. The patient brother live in Australia, just had a coronary bypass few months ago. You are core training, CT mean core training, like you are junior doctor, came in behalf of consultant Mr. Mann as he has emergency operation abdominal aortic aneurysm. Okay, so just write a notes in paper, and after that I ask you some question.
Okay.
When you're ready, just tell me.
Okay.
Okay. By the way, in the script, in the details in the script, the CT in the hospital is not working, so we're unable to do CT for him. I forget to tell that. Okay, so we can start.
Hello,
Hello.
I am a CT doctor. I am responsible for your husband's case. May I confirm that you are the wife of Mr. Mr.
Man. No, man is the doctor. Gray, Mr. Gray.
Gray's
Yes,
wife?
I am Annie. So it is important to write in the notes the name of patient. Yes, I am the Gray wife, but I don't expect you to come. I expect Mr. Man to come. Why he sent it you to me? I am angry and upset because Mr. Man is not respect me and not come. Is the other patient is important than my wife case? Of course, the patient speak loud and speak in angry manner.
Okay, of course, I understand your worry and I understand your anger, but unfortunately, Mr. Man has been called away for an emergency case. Of course,
This is emergency more than my husband case.
well, your husband case is very important to us, but this patient has an emergency case. He needs an urgent intervention from Mr. Man. So for now,
What you mean by emergency case? Like what? He can wait. This patient can wait till he finish discussion with me. Patient can wait 2 hours. What is the problem? Is this patient with this disease, what you mentioned, can wait 2 hours or not?
well, no, in this case, he cannot wait because
Why cannot wait? What he had?
well,
Okay, you can see the script again.
yes. he has aortic abdominal aortic aneurysm. بس انا هقول لها الموضوع ده مش
طب دكتوره انت احنا يعني انت up and down, so they have emergency operation in big artery in his abdomen and it can be ruptured at any time, so we need to save his life.
تمام.
We don't speak in medical term, but it is emergency situation. It is not appendix or not removal of elective cholecystectomy. So we respect you. Mr. Mann is always is keen to come, but suddenly they call him in emergency because have a patient of rupture of big artery in his abdomen, so must impending rupture, so must go to there. All right, okay, no problem. All right, so thank you for coming, doctor. And are you sure that my husband have advanced case, advanced cancer?
Well, it is too early to say this. We have to make more investigation and more imaging.
So this is wrong answer, Dr. A, but I explain to you later. So, doctor, so how to give diagnosis only from one test, which is a cytology? Is any error in cytology? Are you sure it is malignant cell?
Well, we can do a biopsy.
No. Doctor, you did a test called cytology, aspirated cytology. The doctor, I see him just clean the area, put a needle, come out, put in the slide, and after second day, he say, you have a cancer, you have malignancy. So this is true, this is sure, or you are not sure?
Yes, cytology is a very sure diagnosis.
So sure he have a cancer.
And for now, yes.
So why you tell me in the beginning it is early to tell that? So is
Well,
it early to tell that is a correct answer or not?
not.
Okay, so it is not early to tell. Yes, your husband have a cancer because this is cytology examination is accurate 100%.
Okay.
So where does cancer come from?
well ممكن أشوف الستام تاني.
Okay. Usually in exam you have the stem in the second. If you have preparatory stations, you have this.
Okay.
Okay, we don't know from the where the cancers come.
Yes. I'm not sure
Okay.
yet.
All right, not sure yet. So, is any definite cure? What is the treatment option?
We have multiple choices. We will start by chemotherapy and radiotherapy, and if he advances and become good with the treatment, we will continue with that. But if he doesn't, then we will consider surgery according to the cause.
So,
of
what
his
is surgery you can do in malignant ascites, whatever? What is his surgery can do? Is any definite surgery for this condition?
There is no difficult.
Okay, so no surgery. Okay.
Yeah.
So I hear from the nurse that the CT is not working. Sometimes we call it broken, but not broken like breaking a glass. So it is not working. So what shall we do for this problem?
Well, we will wait until the CT is fixed, and if it's not fixed, we can transfer him to another hospital.
This is wrong also, doctor. So if you need to transfer to other hospital, why? What makes the difference if you transfer to another hospital to do CT? Is the CT is the type of treatment?
No, but it's mandatory for the investigation, for the diagnosis and knowing the cause.
If you know the cause is different on the management, you make it.
Yes.
How to make it difference? If suppose we know that it is arise from the liver and they have malignancy in both liver, or it is from, if it is female, from ovary or other organ. So what is the difference? What you consider my husband case? It is advanced case or early case can be treated by surgery?
Well, that's why we need the CT, because it's too, we don't know if it's advanced yet, or if it's in early cases, in early stages.
Okay. All right. Okay. So his his brother just have a coronary and he live now in Australia. Shall I call him to come or not? What is your opinion?
As I told you, it's too early to call for him. The only thing that we have in our hand is to analyze his case, and we are waiting for the CT to know more about his
Dr.
condition.
Aya, we repeat the station again with you. First, you repeated it is too early many times. Okay. And of course, if you have patient with malignant ascites, it means that it is advanced case. It is like Rockenberg tumor. So it is advanced case. And advanced case in tumor, except in the patient have like intestinal obstruction for cancer colon, so no surgery done. In advanced case, we can, if the patient have cancer colon with metastasis in many organ and have intestinal obstruction, we can do colostomy or mild or limited resection. But malignant ascites, it is mean advanced case. So it is not early to mention that. So you need to invite it or to tell his brother to come. This is first. Second, CT, if you did the CT now, you did it after 1 week, is not make a difference because we sent this patient to chemotherapy and radiotherapy or multiple discipline team to discuss what is the way we give him chemotherapy. So this is advanced case can treated by oncology, not by surgeon. Of course, this is 5 legal aspirated cytology, a short test. So again, if you are in this attitude in exam, you 100% you will be in critical situation. Okay. So we repeat the scenario again. We just know it is not early. We just know that CT is not give much information. It can, for my interest, okay, but for the sake of patient, if CT done today or done after 1 week, not make a difference, and we don't need to transfer the patient, and we don't say, sorry, we don't have only one CT and all this. So we start again, the script in front of you, and you can just make your mind and start.
Okay.
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 When you're ready, tell me. Okay, doctor. Good morning. You can start.
Good morning. I am Dr. Aya. I'm one of the CT doctors responsible for your husband case. May I confirm that you are Mr. Gray's wife?
Yes, I am, and Gray White, but I don't expected you to come. I need the consultant, Mr. Man, because I have many complaints. Where is Mr. Man?
Mr. Man has been called away for an emergency case. I will see what I can
we
do.
also emergency case. My husband, they tell him he will die. So how it comes this emergency is not important. It is important than my husband case.
As doctors, we consider all of our patients' priorities, but the other patient has a case that can endanger his life. He has bleeding in his abdomen. This bleeding, if it's not treated immediately, it can cause him to die.
Okay, thank you, doctor. So are you sure? Because my husband is sad, and also I said, because someone tell him yesterday that he have advanced cancer, although we just 2 days in hospital. How he knows that he have advanced cancer? Only from one test and the blood test.
Well, sorry for that. I understand your pain and your worry, but the test we did is cytology test. It's a definitive test and they diagnosed your case, your husband's case, as advanced cancer.
So
And
this is test is sure test. So it is from one test you can diagnose cancer. Are you sure?
yes, we are
So it
unfortunate.
is sure that it have a cancer.
Yes, I'm sorry to tell you
Okay.
that.
So where this cancer come from?
Well, we are not yet sure where it comes from. We will need more diagnosis and more imaging tests to confirm the cause.
Okay. So I know that the CT is not working here. So is any option, any alternative? Can I send him to other hospital or other country to do CT and back again?
Well, unfortunately, the CT, we only have one CT, and
So this
transferring
is
him.
big hospital only have one CT.
Well, yes, for now, but you don't need to worry about that because in your husband's case, we don't really need the CT to confirm his diagnosis. Cytology is more than enough to tell us what is the cause.
So is any surgery can be done? You can
Well,
do surgery. Are you surgeon, doctor? Yes, I think you are surgeon. Is you can
yeah.
surgery to remove this acidic fluid and all this?
Well, as I told you, your husband case, he is advanced case, and we can't do surgery to save him, but we can do palliative treatment like chemotherapy and
So
radiotherapy.
who will treat him?
My consultant, Mr. Man, is going to treat him. He is
No,
very,
no, no. It is, you mentioned it is not by surgery. So who will treat him?
we will call them uh, MDT team and the
What does
oncology
MTT mean?
multiple tumor center.
Multidisciplinary team or radiotherapy or oncology team. Okay. All right. So this is considered as good or bad or poor prognosis?
I'm sorry to tell you that, but it will have most probably a bad prognosis, but we will wait and see, and we will hope for the best.
Okay. All right. Okay. So what about his brother? He is in Australia and have just finished coronary bypass 2 weeks ago. Shall I ask him to come?
I'm sorry to say that about the brother, but yes, he will need to come because your husband will need all the family support that he can get.
Okay. So again, just I repeated, so can go even to Australia to make this CT. So is this CT if done or MRI or whatever, it can make a different in the treatment line or diagnosis or prognosis?
No, it can't make any difference in your husband's case because it's advanced case. And we will do palliative treatment for now, and we will wait
Okay.
for what the oncology team tell us.
All right. Thank you, doctor. Okay.
Okay, you understand what we have said?
You can
Um,
summarize to me.
okay. I have told you that your husband has advanced case of cancer. Right now, we did cytology. It's more than enough to tell us that he has a cancer. We don't, the CT is broken, but we don't need it in the diagnosis. It won't make any difference. We will inform the oncology team and the MD team. They will come and they will choose the best management for your husband. But for now, we will do a palliative treatment for him, like chemotherapy or radiotherapy. Um, you informed me. You will tell his brother to come. This will be great for your husband because he need all the family support he can get right now. And if anything new happen, we will tell you immediately.
Okay,
That
but also I need to meet Mr. Man. So I think it's better to tell her after he finished the operation, he come to chat with you, or we can ask the nurse, the secretary to contact you to discuss the case with him. Okay?
okay.
Thank you. Of course, this is a case have a lot of debate because most of the student is concentrated, sorry, and he take it from ethical point of view or communication point of view, but from medical point of view, this is malignant ascites, mean advanced case. Is the
Thank
only exception in some country is not in England. If a patient have TB and have ascites due to TB, but not malignancy, can be treated. If patient have lymphoma, can be treated, but lymphoma usually don't cause malignant ascites. Malignant ascites or Krockenberg tumor usually in the ovarian or gastric or sometimes colonic tumor. So it means that advanced case. Again, the common mistake by student, it is early to discuss that. It is early to tell you about that. It is not early. If you
you.
take a fine needle aspirated cytology from a lady and come to, it is a malignant, so sure it is a malignant. Because when you reach this stage, you take a history, the patient have loss of weight, the patient have something, all this. So it is important to know malignant ascites is advanced cancer. CT of no value. CT is not line of treatment. It is just for your interest. I am interested to know what is the origin of this tumor, but it's not affect the patient life, not affect the prognosis, not indicated for surgery, nothing.
تمام.
Okay. Thank you, Dr. Aya. Okay, I
شكرا.
found a lot of hands raised, so we can start by Peter. What is your opinion?
I just have one question, Dr. Shereen.
Okay, can.
About cytology,
Yes.
we took in pathology that cytology doesn't differentiate between malignancy, benign or malignant cell.
No, it
So
is only for what
how
you
can
mean.
I?
It is, no, it is for follicular adenoma and follicular adenocarcinoma in the thyroid only. In the cytology and follicular adenocarcinoma, it is difficult to differentiate between adenocarcinoma and adenoma in the thyroid. But if you take malignant cell, it is like Pap smear taking for cervical smear in the female for cancer uterus or cancer cervix. It is sure if we have malignant cells, the patient have malignancy. You need biopsy later to know that it is carcinoma in situ or cancer, but in this malignant ascites, we found adenocarcinoma, so it is a cancer. Okay, so you are sure.
But we don't need to
Trust
do
me.
histology. It's only cytology.
What you mean by
Okay.
histology? Because we don't have a tissue. If you are interested, you can make a laparoscope and found any organ like liver and take biopsy from this organ can, no problem. But it is malignancy, so you need to treat it as a malignancy. Okay.
And we have to know the first origin. Okay. Thank you.
Not make much difference, but it means that it is advanced because the patient is wonder how it is within 2 days from one test. He say that it is advanced case. Actually, it is advanced. It is like if you examine the breast case and they found the patient have pleural effusion and you aspirate, you found it is a malignant pleural effusion, or you did bone scan, you found the patient have bone secondaries. So it is advanced. I think many hands, Dr. Ahmed Habib. What you need, Dr. Ahmed?
Yes, I just want to ask regarding the CT. Is it not urgent, so we can delay it for a few days, or we can just skip it and not do it at all?
No, it is for my interest. I need to know what is the origin. A doctor usually have interest. But for your opinion, we need to transfer the patient today by ambulance to other hospital to do CT or not?
No, not today. Not today.
Okay.
It can be delayed for up to 1 week, 2 weeks, but
okay, it's not urgent.
after
not
2 weeks, after 2 weeks, if the CT is not working, should we transfer him for the staging of the disease, for example?
If the hospital have oncology unit, so is okay, he can stay in hospital. If we transfer him to cancer institute, so the usually cancer institute have CT, but it's not matter of CT. This is scenario is not related to CT at all. This scenario, it is just to confirm that if you have advanced cancer, it is advanced cancer and the bad prognosis. So you can wait, no problem. Don't be in hurry. Don't concentrate in this scenario to fix the CT or to go to other hospital, or some students say we can do ultrasound but not much accurate. We can do MRI, but sometimes the CT is better. We don't discuss the CT value. We discuss the patient condition. Dr. Muhammad, I think you all raised your hand again. What you need? MHMD, because the names is not clear, is started by M. What you need?
No questions,
Okay.
Doctor. Thank you.
Okay, Dr. Yasin or Yazin, what you need? What you ask about?
Doctor, I want to ask you that we should do CT because the line of chemotherapy, if it's ovarian cancer or liver cancer, doesn't change.
But because this is male patient, so it is in the female, of course, you need to know it is ovarian or what? What else you need? Ovarian or what?
Liver cancer,
can be
cancer.
stomach, can be liver. Okay, can.
Yes.
Okay, but it's not the matter of this discussion. It's not so urgent to transfer the patient. We just, this station is just have two questions, which is answered wrongly by Dr. Aya first. She said many times, and it is common in exam, it is early to mention that, which is not correct. And even when we ask about his brother to come, she said it is early to discuss that, which is not correct because it is advanced cancer. So this is the aim of the script, that you know that if you have advanced cancer, it is advanced.
So I shouldn't tell the wife that the CT will change the line of treatment. Yani we should know, we should do CT.
This line of treatment is from surgical point of view because this is surgical exam. If you speak in behalf of the chemotherapist or in behalf of surgeon in this situation.
Okay, I see.
If you speak in behalf
surgical
in the surgery, not make you difference. You don't open to see. If you have much interest, you can do laparoscopy. But if you are interested, but it's not make a difference in the patient case.
Okay, thank you.
Okay, if your query it is ovarian, you can do tumor marker code the CA125. If you're interested to know it is ovarian or not, if the female is male, so you can do tumor marker, some tumor marker. If it is in the liver, you can do alpha fetoprotein. So have many alternatives. I think
Yes,
other doctors, who is else? Muhammad Ascites, what you need to ask? Dr. Muhammad, you raised your hand. Is any question? Osama Al-Gadi, what you need to ask? Al-Qad, okay.
Yes, doctor, I need to ask about if the relative of the patient, he convinced me about what I can do now. The CT is broken. يعني بعد ما أقول لها the CT is not important, just for interest to know what is
not important. It is not change our decision as a surgeon. It's not change that instead of I do operation or don't do operation. From surgical point of view, is not make much difference. Maybe from oncology, they need to know maybe chemotherapy for liver or for ovary or for stomach may be different. I don't know. So maybe they ask for that. But from surgical point of view, from Mr. Ben and his team point of view, the CT not make a difference because we don't open, we don't have a surgery, we don't remove an organ.
Yes, but when ask me what's the management?
The management, we transfer him to oncology team because this is advanced case and this is treated by either chemo or radio according to the patient
It's not
condition.
surgical case.
It is not our business. It's not a surgical case.
Okay. Thank you.
Okay, clear. Any question? Anything else?
والله يا دكتور كنت اللي كنت الحاجات اللي حافظها انا كانت الاجابات بتاعتي كلها غلط يعني صراحه.
لا هي مش حكايه غلط او حاجه. It is your response, so don't worry. Okay. Even with this wrong, even with this not ideal answer, the student can pass also, no problem. We have a mark. You need to remember that this is exam. We don't have a fail and non-fail station. We have something called mark, like the sum of the mark, like مجموع الدرجات is not fail, and we don't have in our system fail station or pass station.
Yeah.
Okay, so it's not make a difference. Okay.
هي الاجابه الواحده اللي بتكون غلط مثلا it's early to inform the cancer على طول تبدا الريليتيف هتاخذني لحته ثانيه. Okay, now I need to do CT. Now I need to do CT to know is the cancer or not.
Okay, all right. So don't worry, Dr. Sam. So anyone, we have the third scenario. This is like postpone any procedures. Okay, before we start, it is one of the communication skills. So postpone procedure can be operation, can be arthroscope. The patient is angry, and usually the procedure or operation is something elective, like arthroscope, like lipoma removal. Something is not urgent, is not a tumor, is not life-threatening, is not acute appendicitis, is not acute cholecystitis. So it is something we can wait. And this is mainly communication point of view. Anyone need to share? Anyone need to speak to me? Can take the scenario. Anyone? If Dr. Muhammad or Dr. Yassin, any one of you need to speak? Ahmed Tariq. Okay, Dr. Ahmed, you can start. So I show you the script. So you are welcome. So this is also common, but can change it. But it is just something, an emergency. So 45-year-old woman, obese, working in supermarket and have a tear in one of the cruciate ligament, right cruciate ligament of right leg. She took many painkillers for a long time. This caused gastritis. This is important point also. She had appointment today at arthroscope with Mr. Arthur. He called for urgent compound fracture with vascular injury in the theater. You are orthopedic SHO, senior house officer. Mitchell Richard, who is the consultant, ask you to explain the matter to the lady. So this angry lady work in supermarket, have arthroscope. She take a leave from her work, and suddenly the operation postponed. It's supposed to be angry. She enter to her and the patient is angry. You can start.
اوكي ممكن طب اقرا السيناريو بس بسرعه اعرف اسمها.
Okay, take your time. Of course, in exam you have 9 minutes to read the scenario in separate room. In other rooms you can read it. It is important to write your notes, especially the name of patient or all this, or the name of doctor. The doctor is Mr. Richard.
Okay, hello. Good evening. I'm Dr. اقول الاسم، هو الاسم هنا حتى مش
if not mention the names, you write your name. What's your name?
دكتور احمد طارق.
Okay,
دكتور احمد طارق, orthopedics here in the hospital.
Yes.
I'm going to explain for you, and if you have any question.
But doctor, I supposed to have a surgery today. I am unhappy. I am sad because I take a leave from my work and supposed to meet Mr. Richard and we operated. And this is simple operations. It take about half an hour. So where is Mr. Richard? Is any important person than me?
Sure. There is no person more important than you, but it's very but Mr.
Richard is called for emergency. So this is emergency. It's important. This is emergency. Can waiting for 3 hours after I finish.
I understand that you are frustrating, and this is a very hard thing that you listen from me. But Mr. Richard had come for an emergency surgery, and it is have a priority for the surgery.
Why
It
it is
is
have a
currently
priority?
because it is our
I
urgent
mentioned the
surgery.
nurse say the patient have fracture. I remember my husband had fracture many years ago, and he fixed it by plaster.
No,
Why it is urgent?
it's a thing which called a compound fracture, and this is may have a vessel injury. The vessel injury can may a big arterial injury, and it may cause it is a life saving, and it is life
Okay.
saving
So,
for the
doctor,
limb of the
so
patient.
don't waste the time. So it is important from the beginning. Sorry, Mr. Richards is not available now because he suddenly called for life-threatening operation, although patient have a fracture, but this fracture affects the main artery of the leg, and this is artery need to be repaired by vascular surgeon, and at the same time they need to fix the bone. So you explain to her that you have a vascular injury because Mr. Richard is not a vascular injury, vascular surgeon. He is orthopedic. But because they need to make a vascular reconstruction, so they ask him to make a fixation at the same time. So this is why it is urgent. Okay? So just explain her directly, she's urgent because the patient have vascular injury. If we wait, for example, few hours, he can lose his leg because of vascular injury. Okay, that's it. All right, thank you. Next. So next question. So I have my knee done today and
What I
have
can
this
tell for
appointment a few weeks ago, and I take a leave today. What shall I do?
I don't listen well. Please, can you repeat the question?
Okay, so today I take a leave from my work. And this
Okay.
appointment I prepare to it since maybe I take this appointment 3 months ago.
I'm very sorry for that, and I truly sympathize for that. I can write a letter to your employer to explain that we postponed the surgery because of our consultant had an emergency surgery, and I can.
All right, so you give me the letter. Okay, so after that, when I will come, who called me to come?
Okay, at this moment, I can give you any specific date. I will ensure that your case is. I will
So
ensure that
who
your
will
case
call
is
me, doctor?
prioritized.
You call me or the secretary call me?
Okay, okay. Once we know the date of your procedure, the secretary will call you.
Can I take your number and call me? Can you give me your number and you call me or secretary call me?
No, secretary will call you. I'm very sorry for that.
Okay, can you describe painkiller to me?
Okay, I can. What's the type of the painkiller you are taking?
I take paracetamol, but they make gastritis to me, and the pharmacist said no need to take any painkiller because can have a peptic ulcer.
Yes. Okay, I can change I can change your painkiller. I can give you a more effective painkiller for your to relieve your pain.
I think most of painkiller can cause gastritis.
No, I will give you a diclofenac, and it will not affect your and it will not increase your gastritis.
I think it's not much, but it's okay. Any advice to me, or shall I leave?
No, if you have any question.
Okay, so if you need the script again, his patient is obese.
Yes.
Can you see the screen, doctor? Can you see the screen now?
Okay, I can give you some. Instructions. I can give you some instructions to go through. You have to rest your. Sorry.
Okay, go on. I hear
معلش
you.
جات لي بس كول معلش انا اسف. Okay.
Okay, no problem. اتكلم ما فيش مشاكل انا هكلمهم انا. Okay, we can wait you. No problem. Okay, you can wait.
You can rest your knee You can do ice to reduce the swelling. You can do compression with a bandage. And also it's very important to elevate your leg to keep elevating your leg during sleeping.
Okay, all right, thank you. So, okay,
Okay.
so the first, you need to explain to her, it is important, or also the patient is not a doctor, but just to explain to her, it is not a simple fracture, it is emergency because this patient have a vascular injury. If the problem in the work, we give you a letter, secretary will manage that and they give you a letter or send a letter to your employer, and we can, as soon as possible, secretary call you to come. Of course, if the patient have gastritis, it's not wise to give her any painkiller. Maybe give local cream or analgesic tablet. Again, can be worse the condition. Of course, you can advise her to reduce her weight, physiotherapy, and massage on all these, so it is better. So they can advise, like, it is advised to avoid or make some exercise to reduce your weight. You can do some simple sport like swimming. You can go to physiotherapy. Of course, we need physiotherapy before and sometimes after arthroscopy. Okay, so easy station, very common. I think we discussed it many type. So it is so simple. I think I still have some hands. So does anyone have a comment? Dr. Ahmad Tariq, you elevate your hand, so it is just from previous time.
No,
Okay, anyone? Okay, so this is just simple station, just to apologize to the patient. But it is important because I think you are all of you is reluctant to tell her she have big artery or vascular structure, or the patient can, if it is, of course, if more than 6 hours and you have vascular injury, so you need amputation, so the limb or it is not working, you cut the blood supply. Dr. Peter, what is your question? I think you have this
I want to
station
ask
before.
if I can.
Oh, okay.
Yeah.
Go on.
I want to ask if I can tell him that you are not an emergency case, you are an elective case or not.
Say again. You are not
Should I
elective.
tell him that you are elective case, not an emergency case for us? Is it okay to say something like this, or should I say it in a polite way?
Not in polite way, but it is. She knows that it is elective, but she have appointment and she take a leave and all this. So they must respect the patient wishes.
Yeah, but the actor told me that. Are you meaning that I'm an emergency case? You are telling me that I'm not an emergency. I told him you are important to us, but he repeated it again and tell me you mean that I am not an emergency. Am I right or not? So he focused on this part.
He's not an emerging, but is in the elective list. So it is like he have appointment.
Should I tell him that something like that?
No,
I was
no.
afraid to tell him.
No. If you tell you are elective, not emergency, is not a good way for discussion. It is so bad. Okay. So
okay.
it is important to tell her that it is the other cases is urgent because of vascular injury. We don't expect this at this time, and they occupy the operative theater, which will do arthroscope, maybe take a time for fixation and vascular reconstruction. So this is the way. It is a simple station, but just how usually in for communication skills in most of the country, except in Arab country and India, is the easy stations. You don't need to study. And usually who work in England or any other country, even in Southeast Asia, this station for him is so easy. It is not a problem at all
but
in any exam, except in the Middle East.
But they didn't say anything about an emergency situation or any thing like vascular injury or this in the script.
No. You know that the script, by the way, is found in the preparatory station and the other station. Because if we say,
yes, I know, but they didn't
say the patient have fracture, like normal fracture, suppose this patient have fracture, femur, no vascular injury, you can put in Thomas and make it in afternoon. So it's not urgent. If you have normal list and have fracture and no vascular injury, is not urgent at all. I think in Egypt,
Yes, but they
many
didn't ask
countries,
anything.
say again.
They didn't mention anything about the emergency case
Are you sure?
in the scenario. Yes.
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 Yes. Okay. All right. I don't remember, but what station I entered, usually we write something, explain to the doctor even that this is emergency situation, and usually vascular, like in the first case is rupture aortic aneurysm and all this. Okay.
Okay.
We take
Thank
a
you,
note
Dr.
for
Singh.
that. If we not mention, we add it. So don't worry. Okay. The last
Okay.
thing I think
you.
we have, it is also
دكتور لو
related
سمحت
to the.
ممكن اسال حضرتك
Yes.
سؤال؟
Can. Yes.
بليز حضرتك كنت قلت دلوقتي ان is not a good
أنا
way ان انا اقول ان ده مش priority وان ده elective case ونوت emergency case. لو الاكزامينر او الاكتور insist ان هو يقول لك I'm not a priority, am I right, am I wrong? ارد
No,
عليه
he's
ايه
right. He's right, and he is
اتصرف
have
ازاي؟
because he have appointment. ده هو له ميعاد لازم نحترم ميعاده.
انا ما
في حاجة
عنديش
اسمها
مشكله
emergency or not emergency, but we have one room. Suppose in the hospital, Mr. Richard, in the hospital, suppose they have 10 rooms, 10 theater.
اوكي
But this theater
اوكي
for Mr. Richard, this is for Wilson, this is for Ali, this is for Muhammad. So we don't allow to take the theater for the another person. So this is his theater. He have vascular injury and the fracture. He is orthopedic, not a vascular, but the vascular must do his job. So the orthopedic must fix it. So although you are not elective, you are not emergency, but you must do him at least in the next list, like after 2 days, 3 days maximum, because you
انا
give him
فاهم
appointment.
انا فاهم ان حضرتك بتقول دلوقتي ان هو كل دكتور او كل كونسلتنت ليه اوضه
أوضة.
خاصه بيه اوضه خاصه بيه، ولكن هو دلوقتي انطلب مع اوضه الفاسكولار عشان
لا، هو
الامرجنسي اللي
الطلب في
already-
نفس الأوضة بتاعته، هو العيان في نفس الأوضة بتاعته.
انا قصدي انا اصيغ الكلام ده ازاي بحيث ان انا افهم الاكتور ان هو اوريدي انت معاك حق ان انت تخش، ولكن حصل امرجنسي 1 2 3 4.
Okay, you have the right, but we are sorry because this is life saving. We need to save the limb. So we are very sorry in behalf of hospital and Mr. Richard and the secretary as soon as possible. Call you, maybe next list within 2-3 days. And also we send a letter to your employer to explain him the situation.
Okay. Thank you.
Because the patient in some cities or some area, he looking for sick leave and all this. So this is important because, for example, if you work in hospital or work in any place, you have limit for what is called sick leave, like 1 week, 2 weeks per year, something like that. So this is taken from his sick leave. After that, he have a leave without money, like unpaid leave. So this is important issue. Okay.
I see. Thank you.
The last station we have, it is a communication skill also, and splenic hematoma. Splenic hematoma is very common to come. Splenic hematoma, it is the same like injury of spleen, but it's different. Dr. Abdullah Salam, you elevate your hand, what you need, or you need to discuss this case.
To participate, بس يا دكتور.
Okay, you can start. So, Dr. Abdullah, you can see the script now. Okay, I read it for you. So, it's 32 years old, traveled to attend rugby match. Rugby is some way for games. Back from had a car accident, left-sided upon upper abdomen, lower chest, very painful. Who will take a deep breath. Abdominal or ABC, airway, breathing, circulation, deformity evaluation, chest X-ray done, fast scan, focal assessment sonography for trauma done, show fracture 9, 10, 11, left ribs with splenic hematoma. Okay? The patient admitted under observation in surgical ward. All right? The patient insisted to leave the hospital in evening. The nurse called you. Okay? So again, young acyclic, he have fracture, right, left, 9, 10, 11, and he need to leave the hospital. You know that usually young have a lot of therapy. This is scenario can come. Suppose we have a group of patients, one have fracture in the right lower ribs, one have fracture of the left lower ribs. So which one you can discharge him, which one you insisted to admit him to the hospital, medical legal? What is your opinion first before we start the conversation?
The left one should be admitted
Why?
because of the splenic.
Okay, all right, okay. So after that, we will discuss with you how to know the spleen, what is the grading of splenic injury, and all this. Okay, so you can start.
دكتور اسمه ايه؟
is not mentioned. Make it Mr. Wilberson or Mr. Man.
Mr. Man, okay.
Okay. If not mention the name, if not mention your name, just tell your real name. خليها your real name. Okay. No laboratory, everything is okay because everything is done. ABC, everything is done. Sometimes they ask you about this, like what is A, what is B, what is C, all this. Okay.
Okay.
All right, so you can start.
Good morning, I'm Dr. Abdullah Salem. Today I have been told that you want to leave the hospital. Can I ask you first why you want to leave the hospital?
Yeah, I think I am okay. Just a little pain. I can take a painkiller. I see that the doctor, he check my abdomen, he check my respiration, he make all necessary, give me fluid. So the doctor did a good job. So I think no need to stay here in the hospital. So why you insisted to leave me here, doctor?
I understand your situation, but you have to know that people are only kept in hospital when absolutely necessary. Can I explain your case to you? You have what we call splenic haematoma, which means a collection of blood around the capsule of your spleen. The spleen is an organ present right here in the upper left side of your tummy. This may lead to serious deterioration in your life. So you have to be stay in the hospital and to be closely observed.
So I see my friend also motorcycle just near me and have fracture in the same reps 9, 10, 11, but in the right side. And the nurse said to him, can go home. So yes, why you left him?
Because the fracture that happened on the left side, and there's a solid organ present right here under the ribs.
What is this organ in the right side? What we call it?
The spleen.
No, right side.
On the right side, the liver.
So the liver, I think liver is like spleen. What is the difference?
The spleen, when it ruptures, it leads to serious deterioration that can lead to danger to your life.
You need to mean that the spleen is soft and the liver is more harder.
Yeah.
Okay, so but now it's stable. So how come if after the spleen now is just have hematoma? So how can this hematoma increase? What is the cause of this hematoma, by the way?
The cause of this hematoma is due to bleeding.
No, I know that. But what is the cause of this bleeding?
Due to the fracture that happened to your ribs, which compressed upon the spleen.
All right. Okay. So can we fix the rib, for example?
Okay. After fixing the rib, you have to be closely observed.
No. What you mean by fixing the rib? What you mean by fixing the rib? You fix it by wire, for example, or no need?
No need.
No need. So you don't fix the rib. So we don't fix the rib, but we're afraid from the spleen. Okay. All right. So what is the function of spleen, by the way? What is spleen? What is the function? All this. Okay.
The spleen has some defense mechanism in the body that strengthens your immunity against some potential infections.
Okay. The nurse tell me tomorrow or today, I think today, they go for CT, for computerized tomography. They say after half an hour, I will go for CT. So what is the CT tell us more than ultrasound?
The CT can give us an image to the size of the rupture that happened and the amount of the fluid present inside.
You mean grading of the injury?
Yes.
I know that I have some medical knowledge because my neighbor is a doctor. can tell me what is the grading of the injury of spleen. Like I hear from him that if I have grade 4, I call him. Actually, he said, if the doctor say you have grade 4 and 5, I think you are in critical situation. So how many grade you have in splenic injury?
We have 5 grades in splenic injury.
So which grade you must have splenectomy?
Grade 4 and grade 5.
So how to know this grading?
According to the CT.
CT. But I already done something, I think it's called the fast scan. What you mean by fast? It means that I am fasting or what?
Fast scan, fast scan.
Fast scan is this fast mean fasting like fasting in Ramadan, or fast mean quick, or fast is abbreviation?
Fast is abbreviation.
Abbreviation, because it is a capital, so it is focal assessment sonography for trauma, and it is done in 4 areas of the body, like right side, left side, epigastric, and lower. Okay, so just for my interest, doctor, if it is fast scan, why you did it in the epigastric area? Looking for what? Is this epigastric area, like upper abdomen? Looking for what?
If there is any abdominal injuries.
No, abdominal injury, right and left, right liver, left spleen. But why you do fast scan in the epigastric area? It is because yes.
Big artery in the center of your
tummy. Anyone knows the answer? Anyone knows the answer?
Aorta.
Cardiac tamponade.
Cardiac tamponade. Okay.
Cardiac tamponade, because echo can done, but fast scan can give idea about cardiac tamponade. And if you need to do pericardiocentesis, you can do through this through the fast scan or guided by echo or fast scan. Fast scan is done in 4 areas, now 5 areas. Right side to exclude liver injury, left side splenic injury, epigastric for cardiac tamponade, and the lower of the pelvis to exclude any free fluid or free urine, like if you have injury of the bladder or injury of any organ. Okay, this is fast scan. Okay, so, all right. Okay, so if the patient is still persistent to attend, because, doctor, tomorrow I have interview, it is important to my job, because I will be, if I need to attend this interview, so to take a higher position in my company. It's supposed to be tomorrow and mandatory. So what is your suggestion?
Okay, I can discharge you, but you have to sign legal documents stating the exact details of your case, and the continued admission was medically advised, and the risk that may happen due to this premature discharge have been explained to you, and you will take the risk for all this responsibility.
So make discharge against the medical advice.
Yeah.
Okay, can you do a favor for me, doctor? Can you send me to my company by ambulance? Just I finish it, the ambulance take me back again. Can do that?
Yes.
Okay, so I think it's better. So tomorrow I can take the ambulance, I go for interview and back to the hospital. All right?
Right.
Okay, if you have a time in exam, so we will ask you, you make this patient have EBCD done. How to confirm that airway is patent or correct?
If the patient is speaking.
Is patient speaking, so you speak to the patient is speaking, so it's okay. Okay, good. All right, so anything about this scenario?
Oh, thank you, doctor.
All right, so any comment from others? I just see.
معلش يا دكتور، ممكن تقول لنا نقطة اللي هو الامبيولانس تاني او الانترفيو دي، لان انا مجمعها.
Okay, هو دلوقتي this patient he speak about tomorrow I must go for interview and it is important for my career. It is like, for example, if it is a student in the secondary school, suppose he have exam tomorrow and he's in hospital. So what is the hospital will do? Either invited the examiner to come to the hospital, or we send to the hospital with some nurse or some to observe him. Okay, this is the idea. Okay, you understand? Yeah, suppose العيان ده هيمتحن ثانوية عامة أو high degree, so you can send him to the to the station or to the area for exam, or you can send the patient to attend the interview and back to the hospital. So this is easy.
هو مش هنا في اللجنه دي هو بيطلب ان هو تشارج اون his own risks.
لا
هو
هو
عارف
he's the patient is not the patient give an idea and you give option. The big problem in some candidates, especially in some area of the world, they have something in your mind. You put from the beginning, before we start, this patient insisted to be discharged against medical advice, which is not true. The patient need to attend the what is called the interview tomorrow. So if you give him option, it is okay. يعني هو العيان عايز يخرج عنده يعني عنده امتحان بكره ثانويه عامه او كليه طب، هتقول له انا اجل الامتحان؟
ما ينفعش.
خلاص، يبقى لو اللجنه تقدر تيجي هتيجي، دي حاجه في الثانويه العامه ما اعرفش هتعمل ايه. لكن لو انت ممكن تروح، ممكن نوديك ويز ميديكال ادفايس، يعني معاك نيرس، لو حصل اي حاجه ضغطك وقع تاخدك بعربيه الاسعاف تجيبك تاني نعمل لك سبلين. يعني انت بتدي اوبشن
هنا
مفيش ايه هو
مش الاوبت مش بيست سوليوشن ان انا اقول له اوكي ساين الديسشارج ومش عارف ايه وتوكل على الله.
this is your attitude. ما هو in the communication skill is different. What is your attitude? You have voice. What, for example, it is like negotiation in politics. You have
انا فاهم حضرتك، هو في negotiations صح negotiations غلط.
لا هو مش غلط برضو، يعني هو مش غلط، بس يعني ايه، مش يعني if you found any other option is better. يعني انت بتعمل لمصلحه العيان، هي مصلحه العيان ان هو ما يضيعش الوظيفه، خلاص هنبعتك بعربيه اسعاف. لو هو بقى قال لك مش هينفع اروح بعربيه اسعاف، مش هيقول لك كده، هو انت اقترحت عليه. يعني هو الدكتور هو تيك ذا سكريبت اور ذا سيناريو، هي دونت منشن ذات. ما هو هي دونت منشن سو اي دونت اكسبت ذات فروم هيم. يعني هو لازم يقترح. يعني انت في مشكله وبعدين انت بتقترح حلول.
فاهم. طب
لكن مش من الاول هتقول له ديشارج اجينست ميديكال ادفايز، امشي مش عايزينك، روح موت.
ولو الاكتور اصر بقى ان هو انا دماغي ناشفه، انا هطلع اتصرف معاه ازاي في الاخر؟
هو الاكتور is not insisted to do anything. The actor the what is called who put you in trouble yourself not the actor. اللي بيوقعك في مشكله انت مش الاكتور. الاكتور ملوش دعوه.
عباره عن ريفلكشن اللي انا بقوله.
الله ينور عليك. الاكتور هو بيشوف انت بتعمل ايه، هو عنده اوبشنز. لو قلت له كذا هيقول كذا، لو قلت له كذا هيقول كذا.
فهمت.
يعني انت suppose when we ask about vaccination you don't tell him about vaccination. So he asks you what is the vaccination, what is the name of vaccination. So they have option. He suppose you tell him we give, for example, after splenectomy, triple vaccine. If you don't say triple vaccine, he asks you what is the vaccine for, what is the name of vaccine, what is this bacteria, what is this bacteria specific, something like that. Sometimes the actor not speak at all if you are in the correct way. يعني انت لو ماشي في السيكول الصح بتاعه، هو مش هيكلمك خالص. عشان كده تلاقي some station or some candidate in the same station, the same actor, they have a lot of debate, some have nothing. So you are redirect the actor and the examiner also. Nowadays, okay. Nowadays the examiner is not maybe not to speak much. They're not allowed to speak much. You just tell him leave the actor he can manage. انت عايز تسأل على ايه بقى؟
انا بقول لحضرتك ان هو انه في اكتر من واي ان احنا مسار الستيشن بيمشي فيها هنا او هنا او هنا. بس احنا ما بنبقاش عارفين ايه الصح او ايه الاوبتيمم واي او ايه الطريقه اللي تضمن ان انت اوريدي ما حصلكش مشاكل في الستيشن.
يعني لا هو ما فيش مشاكل. انت لو انت ماشي يعني in proper way no problem.
في اي اتجاه، في اي طريق، في ده او ده او ده، الدنيا تبقى اوريدي ماشيه.
Yes, it is whatever the way you take it so must be correct.
لان هو بيحكم على الكوميونيكيشن مش على الريزلت اللي انت وصلت لها في الاخر.
لا هو the idea is this is dangerous, he can have bleeding at any time, so don't discharge him. Either discharge against medical advice, either for ambulance to him for the interview and back. So this is the two option, no more option. انت حللت له موضوع الانترفيو بس. هو عرض لك مشكله انت بتحلها. ده نوع من البوليتيكال. it is a political issue not a medical is not a medical station.
اوكي تمام.
Okay.
فاهم. شكرا جدا.
Okay. Any other comment anyone need to ask? I think Dr.
Yes.
Sharif Gad. Yes. You
Yes,
need to
دكتور
ask.
هو انا بس
Okay, so we start one by one. Dr. Sharif Gad first. Yes.
دكتور شيرين زي حضرتك
أهلا بيك.
بس حضرتك بالنسبة للسيناريو، لو أنا يعني فسرت السيناريو يعني شفت إن أنا هو عنده مشكلة في الانترفيو، عنده مشكلة في السيك ليف أو ودخلت قلته كله ورا بعضه، اللي هو حليت له المشكلة، فهمت هو إيه مشكلته، وبعدين بقيت أكلمه إن هو يعني بقيت باخد السيناريو برد على كل المشاكل اللي عنده المكتوبة لي أوريدي من غير ما استنى إن هو يسألني، ولا استنى لما أقف وهو يسأل وكده.
لا أنت بتقول له خلاص خلص الموضوع. Okay, if he
يعني
understand, okay. If you take, you can see, I sometimes interrupt the student because we have about 20 questions in 10 minutes. So in one يعني في فقرة منهم, if you extend the talk, I stop you.
اوكي
يعني
اوكي
لو انت هتسترسل هي نقطة, انت قلت مثلا I give him vaccine, you don't mention the name, what is the name? You mention the name, I don't ask you what is the name. So I don't have a question, I have a question if you don't tell me the correct answer.
Yes,
So for example, if say I will do fast scan, so automatic, what is fast scan? So if you say I do fast scan, which is focal assessment sonography for trauma to exclude any hemorrhage, okay. If you say we do fast scan or did fast scan, so automatic I tell you what is fast scan. If you see it is MT, multiple disciplinary team, MDT, so I tell you what is MDT. If you see any abbreviation, it's not supposed to know this abbreviation as a layman or the normal person. Okay. Any other question?
Okay. No, thank you.
Okay. Splenic hematoma.
دكتور
Yes. Go on.
دكتور بعد اذن حضرتك، هو في الكوميونيكيشن سكيلز بشكل عام يعني هل لو اللجنه مثلا قصيره وخلصت بسرعه مثلا في 4-5 دقائق اوكي ولا؟
Actually, this is exhausting exam. This is why we make a rest station, because have problem especially with Cairo Center, because it is supposed to be 18 stations. In the past it is 18, now 17 follow each other. But we found the student in the middle become exhausted, especially some girls. So we make a rest station, and some station is very short station just to take your breath, just as a rest, like. Don't say, because if you are in stress all the time, so you don't finish the exam. So this is common. You can in many stations you have a lot of empty time or rest time, no problem. This is very common.
Okay.
Okay.
Thank you.
Okay. Anyone have any question?
التسليم معلش
دكتور بعد اذن حضرتك
بالنسبه
اوكي
المحاضره دي متسجله ممكن نسمعها ليتر اون يعني؟
واحد بس بالنسبه which station. اوكي.
اول ستيشن كان في السيناريو بيقول ان his brother has heart problems، اعتقد اللي هيجي من امريكا.
كورونا باي باس، he came from استراليا.
بالظبط. ده يعني انا مش المفروض ان انا اكومنت على الموضوع ده او اقول مثلا ان هو ما ينفعش انفورم هيم او انفورم هيم جرادولي، او لو هو كونديشنز بيرميت تو ترافل، او مش ممكن يعني ممكن ما اعملش كومنت على الموضوع ده وخلاص.
هو I tell you one by one, this is scenario is all over the world. Okay, and we are in Malaysia. I speak to you from Southeast Asia. So Australia is a nearby country. It's 2 hours by flight. Okay, you understand?
Okay.
Australia
yes.
For us is nearby. We don't suppose you are in Cairo. We don't know what is your place. But the question is just to confirm. It is the same mistake Dr. Aya fall in it. It is early to tell him or not early to tell him? This is the question. What do you think? It is early or not early to tell him? Okay, so I think it's not early to tell him, so we tell him and he will come. ومش هيموت يعني في الطريق، مش مشكلة يعني. هي just to adjust that this is urgent situation, so he must come. Okay.
شكرا.
All right. We want to consider if you need to explain more for exam. So you can say because Cairo is far away from Australia, so he's take a lot. So I think he needs some precaution and special care or something like that. But in other countries, Australia is nearby. It is like between England and the Republic of Ireland, so you can take a ferry or half an hour by flight or something like that. So we don't book, but design the scenario for Cairo Center. It is general scenario. Any other question? Okay. So we still have some few information given. We'll give it next time. Is about confusion patient and postpone also some surgery. It will be the same. So we'll discuss next time. After that, we have a time we'll start in the anatomy. Okay. Anatomy in exam is you have a paper, you have a numbers, and usually it is from the Museum of the Royal College of Surgeons of England. You can find through Get Through Anatomy, or you can find through Macmillan Atlas of Human Anatomy. I will share with you Get Through Anatomy, just to know what is the picture look like. The picture in the Museum of the Royal College is not colored. Not color being like not the artery in red and the vein in blue is like traditional grant book or traditional anatomy book. Okay. In general, as about the exam, anyone have a question? Okay, I just thank you first to stop sharing and okay I will still with you. في حد عنده أي أسئلة أو أي حاجة